Hello and welcome to Wellness Watch, a special show curated to ensure a healthy you. A show that explores the health challenges and ailments that affect people irrespective of nationalities or ethnicity. But the catch here is to acquaint you with a wide array of possible treatments and medical procedures India offers for these ailments. Reliable, cost-effective treatment of international standard in India is not a distant dream now. So let's embark on this medical journey with me each week. I'm your host, Preeti. Imagine a world where infections and diseases in humans, animals and plants are impossible to treat. Now, this worst case scenario could become a reality as bacteria, viruses and parasites develop resistance to the drugs we use to fight them. Antimicrobial resistance or AMR occurs when bacteria, viruses, fungi and parasites no longer respond to antimicrobial medicines. As a result, antibiotics and other antimicrobial medicines become ineffective and infections become difficult or nearly impossible to treat. Today in Wellness Watch, we discuss antimicrobial resistance or AMR that has become one of the most pressing health issues of our times. Antimicrobial resistance or AMR is a global health emergency threatening the effectiveness of life-saving medicines. Now, this silent but growing crisis is already one of the leading causes of deaths worldwide. Every year, World Antimicrobial Awareness Week is observed from November 18th to 24th, aiming to raise awareness about AMR and promote best practices. This year's theme is Educate, Advocate and Act Now. And this highlights the urgency to combat AMR at every level. Today, we dive into how the misuse of antibiotics can impact health, lead to complications and create long-term problems. What happens when self-treatment replaces professional advice and treatment is incomplete? Let's take a closer look at this.
Staying healthy begins with prevention, and our immune system plays a vital role in protecting us. Yet, illnesses are inevitable, and medicines often come to the rescue. Antibiotics, in particular, have saved countless lives by fighting infections. But what happens when they are overused or misused? Today, self medication has become alarmingly common. People often turn to antibiotics for minor illnesses, skip doses, or stop treatment midway. This misuse gives harmful microorganisms like bacteria, viruses, fungi, and parasites a chance to adapt. Over time, they become resistant, making medicines ineffective. This is antimicrobial resistance, or AMR, a growing crisis fueled by human behavior. Here's how it happens. Germs infect the body, multiplying rapidly. Antibiotics are designed to kill them or slow their growth. But when used excessively or improperly, these drugs lose their edge. The germs evolve, becoming superbugs, and are harder to treat and more deadly. The consequences are staggering. For patients, treatment becomes longer and more expensive. For families, the emotional toll of prolonged illness is devastating. And for healthcare systems, AMR poses a colossal burden, pushing us towards a future where routine infections could once again become fatal. The root cause is clear: the unnecessary use of antibiotics. This includes taking them without consulting a doctor, skipping doses, and stopping treatment early. Antibiotics are powerful tools when used correctly, but misusing them leads to side effects and complications. On this World Antimicrobial Awareness Week, the message is simple. We must protect the power of antibiotics. Use them responsibly. Never self-medicate. Complete your prescribed course of treatment. Every small action can contribute to the fight against AMR. Imagine a world where no medicine works, where a simple infection becomes a death sentence. That's the grim reality AMR could bring if we fail to act now. But there is hope. By following proper medical advice and spreading awareness, we can preserve these life-saving drugs for future generations. The fight against AMR begins with each of us. This year's theme, Educate, Advocate, Act Now, reminds us that this is the time to act. Protect your health, Protect your future. Use antibiotics wisely. Harshita Oberoi for Wellness Watch, DD India.
All right, so AMR puts many of the gains of modern medicine at risk. It makes infections harder to treat and makes other medicinal procedures and treatments difficult. Antimicrobial resistance, or AMR, is one of the top global public health and development threats. According to a major study published in January 2022, 5 million deaths were associated with drug-resistant infections. WHO estimates that bacterial AMR was directly responsible for 1.27 million global deaths in 2019. And detailed forecast predicts that without further policy interventions, global deaths would reach 39 million between 2025 and 2050. World AMR Awareness Week is celebrated from 18th to 24th November every year to raise awareness on AMR. Today in Wellness Watch, we explore some very prominent questions. What is the difference between an antibiotic and an antimicrobial? How do pathogens develop resistance to antimicrobials? What activities cause AMR? Can we completely solve the problem of AMR? And also, what medical advancements have been made in India? India has made significant stride in healthcare over the years, transforming itself into a global hub for myriad healthcare services. It has established itself as a prime destination for medical tourists seeking world-class health and treatments at a fraction of price as compared to its Western counterparts. Up on your screens, we'll have institutes which are conducting research on this. Maulana Azad Medical College, Delhi; Sawai Man Singh Medical College, Jaipur, Rajasthan; Karnataka Institute of Medical Sciences, Hubli. All right, to talk more about this and to understand how massive the threat is, we have two guests in our studio. We're joined in by Dr. Ghanshyam Pangtey. He is Professor, Department of Medicine, Lady Hardinge Medical College, New Delhi. And we're joined in by Dr. G.C. Khilnani, Chairman, PSRI Institute of Pulmonary, Critical Care and Sleep Medicine, Delhi. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. We've shown a detailed report talking of AMR, antimicrobial resistance. But Dr. Khilnani, for our viewers to register, let's begin with the very starting point. In very quick terms, very easy terms, in fact, I would want you to explain to our viewers what are microbes and pathogens.
See, microbes could be virus, could be bacteria, could be parasites, could be mycobacteria, which causes tuberculosis. When it is concerns bacteria, we call it antibiotics. A broader term is antimicrobials. That's about it. Nothing great about it.
Okay. Dr. Pangtey, how do microbes, or for that matter, how do infections, bacteria, how do they become resistant to drugs?
Yeah, as Dr. Khilnani said, antimicrobial means it may be virus, it may be bacteria and other things. So main concern and main treatment in medicine or allopathic medicine is antibiotics. We want to kill those bugs, especially bacteria. So for those bacteria, when we treat appropriately, like someone has a pneumonia, so we have an antibiotic for that. So we have to give appropriate antibiotic to kill that pneumonia bacilli or a bacteria, and we have to give it appropriate duration also. Like in a pneumonia, we have to give it at least 5 to 7 days of antibiotic. So appropriate diagnosis, appropriate treatment and duration also. When we don't give appropriate durations and someone takes just 1 or 2 tablets, someone takes a different tablet which is not effective on those bugs, like strep pneumonia is the most common cause of a pneumonia. So if you don't give an antibiotic which is not causing that, not treating that thing, and you give an inappropriate antibiotic, inappropriate duration, then they develop a resistance. Those bacteria will become resistant to that antibiotic, and when we use it in any other circumstances, then they will be not effective. Okay. So pneumonia may become a resistant thing, and a lot of antibiotic resistance comes from environment also. So we are treating as a physician in a medical college and a patient. There we treat small dose like 5 to 7 days only. But a lot of antibiotic is being in animal husbandry and all. So that percolates into your environment, in your food web, then that cause more problem compared to a human antibiotic treatment.
So can I add something?
Yes, sir.
So it was 1942 when the antibiotics were invented by Sir Alexander Fleming. Penicillin. It was a magic drug. But in his Nobel laureate speech, he said the thoughtless use of this drug, the person who will be responsible for the death of another person who subsequently suffers from drug resistant antibiotics. So that sentence actually, come to think of wisdom of that man who invented penicillin, that he knew that if you use it inappropriately, as Dr. Ghanshyam said, you create resistance. If I put it crudely, if you are fighting an enemy, either you kill him or he becomes stronger.
Yes.
And those people who survive the war will be more stronger. So that exactly what happens when we use the antibiotics in lesser dosages or in the for the lesser number of time. The bacteria which are left over, this is a very crude way of putting it, not a very biochemical,
And
they become resistant.
That would make the audience understand it better.
They become resistant. So next time when the same drug is used for that infection which is transmitted to the other people also, those antibiotics will not be effective. So that is exactly what has happened today, especially in the intensive care units, that we get reports from our laboratory where the bacteria is sensitive to no antibiotics. And that is the reason that WHO has projected that by 2050 every year 10 million people will die of only this problem. It's a very serious problem, so we'll take it forward as you ask.
All right, very quickly, Dr. Pangtey, explain to our viewers what is the difference between an antibiotic and antimicrobial.
As we have already discussed also, the antibiotic is especially for killing bacteria.
Right.
So like we have common term like we have a lot of infections, microbes. So microbes can be virus, can be fungus or bacteria also. So in antimicrobial, all antibiotics will also be involved, while antimicrobial may involve antiviral and other drugs. So most common infection, if you see nowadays, like there's an outbreak going on dengue. It's a virus, so you don't need antibiotic there. Most common respiratory infection causing is viral infection of flu and respiratory infection, which is viral. So you don't need antibiotics there. And as such, because these are self-limiting disease, we don't even need antiviral there or antimicrobial. So public should understand where we want to use antibiotics. So anywhere we suspect any bacterial infection, then only we should use antibiotic. And usually these symptoms are slightly different in a bacterial pneumonia and all. So there a good doctor or a physician can only diagnose that patient has a bacterial infection. That's why we advocate that only antibiotic to be used or antimicrobial should be used when there is an infection, especially bacterial or any treatable viral infection.
So if I could add to that.
Yes, sir.
So we are in a very bad air pollution. People are having cough, sore throat without any fever. They are bringing out sputum also.
Yes.
They come to us. By the time they have come to me, they have already taken 1 or 2 courses of antibiotics. That is most inappropriate way of using antibiotics. Unfortunately, in India, the antibiotics are available over the counter. People go to and they say, okay, like in COVID, azithromycin was something like in the tap. Anybody who had suspicion of COVID, he started taking azithromycin. So that antibiotic will become useless for, if it is used inappropriately. And that is exactly what this AMR is all about.
Okay. All right, Dr. Pangtey, now it was a very important point which you explained, that from our environment also, we are susceptible to AMR. When does a person get to know that he is, antimicrobial resistant? One. And secondly, as doctors, how do you take that forward? How do you treat it? If a person is not responding to a particular drug, does that mean the disease can be life-threatening to the person? When is it that, because as Dr. Khilnani also said, when patients come to them, when patients come to him, they've already taken say 2-3 courses of antibiotic themselves. How do we deal with this?
As you said that when the person or a doctor knows that patient has developed a superbug or an antimicrobial resistance. So what happens, like any infection, like we were talking a lot of pneumonia and all,
Yes.
we can take a urinary tract infection or maybe abdominal infection. So patient come with a urine burning symptoms, he may have a fever, he may have abdominal pain. There we suspect it's a urinary tract infection. We do samples, we will take of urine, we will do a urine routine microscopy to see pus cells which suggests it's infection, or we do cultures also, okay. So we will do cultures, and cultures take at least 48 hours. So we will wait for 48 hours, but because patient is symptomatic, we will start treatment. We treat most common antibiotic for UTI which we give, we start antibiotic, and after 2 days you will see that patient is not responding. Fever is still there, patient is very sick looking, patient has abdominal pain and fever is very high. Then by the 2 days, 3 days we will get a culture report. So in culture we have a list of antibiotics. So we have a basic antibiotics like WHO says, then we have a antibiotic which should be slightly less used, and lastly which are reserve drug, which are very important. These are the last resources.
Right.
So when the cultures comes there, we see that the patient is totally antibiotic resistant to most of them except for 1 or 2. That is the last reserve drug. That means it's infected with a superbug, and most of those drugs are not effective. So we know the cause, we know the exact, it's a documented thing. So there we have to give that antibiotic only, like a lot of antibiotic, like we say carbapenem or these monopinum group of drug. There's a colistin group of drug which is polymyxin. So these are the last resort. There's no antibiotic which is now above that. So we see that only 1 or 2 antibiotics are left, rest all are non-effective, and he cannot survive unless we give those drugs.
Okay.
So we have a documented thing.
All right, this is about adults. This is about severe or critical,
No, it's a simple, all UTI, we are talking UTI.
All right, okay. You're talking about UTI. But Dr. Khilnani, how prone are children to AMR? Because antibiotic is a very, is widely used in, is used widely when you talk of pediatric use. How prone are children to AMR?
Preeti, the bacteria or microbe, they don't differentiate between children and the adults. But the den of AMR is intensive care unit, ICU, as you must have heard. And I would like to talk about 2 things. One is ICUs, another is tuberculosis, which is very important. So in ICU, what happens that it's a closed environment where patients are there, they are treated with high-end antibiotics, and their ventilators are there, equipments are there, transmission is also there. So usually they become a sort of a reservoir of multi-drug resistant bacteria, and as I said at the outset that we do get infections where there is sometimes it is pan resistant. Pan resistant means that it is sensitive to nothing, whatever the antibiotics are. And I want to tell you through you to the viewers, people may get new names, but for last 30 years there has been no new class of antibiotics available to us. We are using only the same antibiotic. We have started using antibiotics which we used 40 years back because they were not used.
And this calls for attention, isn't it? Yes.
So that calls for attention. So that the WHO saying educate, education is not only for the patient, education requires for the doctors also.
As well.
So if I talk about tuberculosis, these are also microbes, not called bacteria, but they are called mycobacteria. Today MDR, multi-drug resistant tuberculosis, is such a problem that if someone is diagnosed with MDR tuberculosis, there is only 50% chance he can be cured even with best of the medication, continued for sometimes 6 months or 18 months depending upon the regimen. Why it occurs? It occurs because when the sensitive tuberculosis patient is given treatment, either he does not take it for 6 months, or he takes in the lesser dosages, or he has side effects, so he stops it, or he goes to the other homeopathy, Ayurveda, stops that. So then he has got MDR now. Now he goes into the community, he transmits all over. So transmission is both in the community. What you talked about the non-medical use in the poultry, you would be shocked to see the amount of antibiotic, the concentration of the supranormal dosages of antibiotics given to poultry, or even where this
In fields
animals
also,
and
in
all
agriculture
those,
also, yes.
when the meat and all is
Yes,
done.
yes.
To have a better yield, they give them large dosages of impure antibiotics, and those antibiotics will go into the water then.
Yes.
They go into the mainstream, and drug resistant microbes also go along with that because they grow. So it's not a problem of only doctors or nurses or healthcare. It has to be a multi-pronged approach to fight this. Most important thing is, on the part of the patients, they must not take antibiotics unless prescribed by the doctors. Number two, there is also need to educate our fellows also about the use of antibiotics. Number three, most important thing is that this country need to improve the microbiological facilities.
Right.
Come to think of a doctor who is working in a smaller place, he doesn't have access to the microbiology laboratory. How would he realize that it is a bacterial infection?
Right.
Unless it is cultured. So the advanced countries, developed countries, you may do anything, but you can't get an antibiotic unless prescribed by a physician. But unfortunately in our country, you go to the chemist, you say, I have fever, they'll give you antibiotics. That's a huge problem.
All right, so this is a grave concern. Yes, sir, you like something?
Like Dr. Khilnani has already told, this environmental exposure to antibiotic is so huge. If you, I've just checked the data, they suggest whatever antibiotic has been developed for last 10 years around. So almost 70% is used in animal husbandry. So humans have used less than 30%. So most of the antibiotic is going to animal husbandry, poultry and all. And they are there, and if you see the data of India, there's one doctor per 800 person. And there's only one veterinary doctor for 8,000, almost 10 times less. God. So those people, there's a lesser this veterinary doctors. And I don't think this poultry and farm, any veterinary doctor sees that patient. This is seen by the farmers, the local authority who opens these things.
Right.
So they are pouring so much of antibiotics in the environment, that environment, whatever we eat, whatever water that feed goes to the soil, it goes in contaminated in our food system. That causes a lot of antibiotic resistance. So we need, like sir said,
the situation,
all stakeholders has to come together. So next meeting should be not only doctors, it should be stakeholders like government, there should be farmers, veterinary surgeons. So what to do about these things? They give prophylactic antibiotics. Now
that the situation is so grave, what medical advancements have been made in India with regard to this?
That's a pretty very good question, as we said, that culture take 48 hours, but now they are biotechnological based tests, which will give us report within 2 hours that this is virus, this is bacteria. They also give some idea about sensitivity, but unfortunately this is something recent and they are very, very expensive, very expensive, so not available all over. But whatever is not available today will be available tomorrow to all over. So within say 2 hours or 3 hours we come to know that this is a virus. So if it is a virus, we don't give antibiotics. If it is a bacteria, we know that at least bacteria, and we know for which bacteria which antibiotic is good. As we said in the beginning, if you give inappropriate antibiotics or inappropriate dosages or unnecessarily, you create resistance.
Right.
That is where we are.
All right. For our viewers who are watching us, this is Wellness Watch, and today we are discussing antimicrobial resistance. This is a grave situation, and we have doctors who are discussing and explaining to us how grave the threat is. We are joined in by Dr. Ghanshyam Pangtey from Lady Hardinge Medical College. We are also joined in by Dr. G.C. Khilnani. He is Chairman, PSRI Institute of Pulmonary, Critical and Sleep Medicine, Delhi. Sir, you explained to us very nicely, but for our viewers to get some myths cleared, we will have a quick rapid fire question round, and let's see how many doubts are cleared with regard to that. Dr. Khilnani, antibiotics are effective against all infections, are they?
No, they are not. They are only effective against bacteria.
Okay. Dr. Pangtey, antibiotic resistance is only a problem for people who take antibiotics frequently. Is it so?
No, it's a problem of universe all over all people, all universe, even now we talk even animals and all.
Yes.
So it will affect everyone, and once any superbug comes like COVID and all, we all are in a bad position.
All right. Dr. Khilnani, vaccinations do not help prevent the spread of AMR, does it?
No, vaccination will control the infection. Like for pneumonia, we have vaccine. So if you reduce the number of infections, you reduce the AMR. So vaccinations have a big role to play in control of infection. Indirectly, they will control the drug resistance.
Dr. Pangtey, do we have a one-for-all rule for antibiotics that applies to everybody?
Yeah, few rules have been made by government as well as WHO that we have to prevent the infection. So hand hygiene and this aseptic precaution in hospitals and even at home will be important, and not using antibiotic without any prescription. So doctor's prescription should be there, and we should be aware, like the aim of this program is educate, advocate, and act. So we have to educate people that you should not take antibiotic as simple one day of fever, simple running nose. You don't need antibiotics. You need antibiotics only when there is a bacterial infection, and they have totally different symptoms compared to viral infection. So you have to see a lot of information is available everywhere. You have a doctors, family doctors.
Yes.
They will help you. So not everyone should not use antibiotics.
All right, everyone should not use antibiotics. But Dr. Khilnani, can we stop the use of antibiotics in between if you feel relief?
No, that's what it is.
Yes.
You know, suppose you have a pneumonia with streptococcus pneumoniae, the guidelines say that antibiotic duration should be 5 to 7 days. If it is a severe infection, it is for 14 days. The particular bacteria is cultured, suppose for the purpose is the drug resistant Klebsiella is there, it should be for 14 to 21 days. So this is what is happening in tuberculosis, that because the duration is 6 months. Since they are all right, they stop medicine in between, and that is how the drug resistance develops.
All right, very quickly, a quick closing question to both of you. Can AMR be cured or be treated completely?
AMR is not a disease. It's a problem of bad use of medical science.
Okay.
The principles are known and the actions are known. Like India has guidelines for using antibiotics in ICU. The Indian Society have written. ICMR gives guidelines. Those guidelines should be spread and should be used by the doctors. So we doctors have a responsibility towards controlling AMR.
Okay. Dr. Ghanshyam, like just a while back we talked about the how prone are children. Over the years, when children grow, when their bodies develop, is it easier to tackle AMR in children once they grow up? If you have a cautious use of antibiotics for them?
As sir said, that microbes and bacteria doesn't identify children away from the adults. But children cannot express their feelings or what symptoms they are having. So when they become adult, it's easier to understand their feeling and understand how to give. Even treatment, they don't take it.
Right.
So there's a difference between pediatric and adult. Otherwise, bacteria doesn't differentiate between any adult or a child.
All right, on that note, we'll end this discussion here. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. All right, so both our doctors explained to us how grave the situation is at present. AMR will soon be as urgent and as significant as a challenge as is climate change. Antibiotics are for global good, and we all need to take responsibility. Remember, widespread use of antibiotics promotes the spread of antibiotic resistance, but smart use of antibiotics is the key to controlling its spread. On that note, we'll end this edition of Wellness Watch here. Thanks for watching. Till we meet next, take good care of yourselves. Bye-bye.